As we track the state's efforts to get vaccines to priority groups, thousands of Washingtonians who were first in line feel like they fallen through the cracks.
Q13 Simone Del Rosario explains how adult family homes across the state feel they've been overlooked in this crisis. This is the majority still wait for vaccines nearly 2 months after the first doses arrived.
If anything, kind of reminds me of a swim meet right before a big event, like especially a relay kind of thing, like it's go time.
Special Olympics athlete Marsha Barrett is ready to take the plunge.
You just get nervous like right before, and it's the kind of nerves that are the perfect ones because that's what's going to motivate you on.
The buildup was months in the making for Barrett and her roommates at this adult family home.
It was one of those things where it was just uncertainty for like literally the longest time.
Wondering when they'd be able to get their COVID-19 vaccines.
What are you most looking forward to with getting vaccinated?
Being able to have a little bit of normalcy, because that's something that for people with intellectual and developmental disabilities, especially like autism, that's something that we crave is normalcy or being normal or being accepted. So that's the biggest thing outside of sports that was taken away from us.
People with intellectual developmental disabilities in congregate care are at a much higher risk of contracting COVID and dying than their peers. Barrett lives in an adult family home in Bothell, one of roughly 3,400 adult family homes in Washington state. The smaller residential homes serve up to 6 residents each, with many of them delivering high acuity care.
We have served some of the frailest clients in any home and community-based setting.
John Ficker, Executive Director of Adult Family Home Council, says despite being long-term care facilities, these homes have been largely forgotten in the vaccine rollout.
I feel that just simply because of the size of our homes, we have intentionally been deprioritized, and we find that offensive.
Ficker says just about 1/3 of the homes in the state were able to successfully sign up for the federal vaccination program after weeks of confusion over whether they even qualified. And the home where Barrett lives, getting vaccines 6 weeks after first qualifying, is still lengths ahead of most homes, where CVS and Walgreens have them scheduled into February and March.
Then to have those calls that say things like, assisted living and skilled nursing need to go first, it shows that the whole system was designed to support the large corporate-owned facilities over these families that have opened up their homes and agreed to be licensed as adult family home operators.
For homes that couldn't get on the schedule at all, some municipalities, like Seattle, have taken vaccinating adult family homes into their own hands with mobile vans. Ficker recognizes getting to all of the homes in the state is a logistical challenge, but says because of the frailty of the majority of residents, on-site clinics are necessary. In a letter to the governor, Ficker called on him to allocate specific staff to focus on this outreach effort, while roughly 15,000 residents and caregivers still lack access to the vaccine. The governor's press secretary tells me they are not forgotten and are one of the highest priorities of our office right now. As noted, they are part of the 1A group, and we're working to get vaccines to them as quickly as possible. On this day, in this chair, Barrett is one of the lucky ones.
So I'm just going to clean the area, be a little poke, and then we'll just have you hang around for 15 minutes after.
No worries.
Her provider able to get an appointment on the books with the federal program. A prick?
Hardly felt that.
And a rush. She hopes others in adult family homes will soon feel.
The big thing I have to say is don't give up on yourself. You will be able to figure it out. It just takes time.
In Bothell, Simone Del Rosario.
One of my favorite quotes is, "Be like a proton, think positive."
Q13 News.
In response to a Q13 inquiry, the Washington State Department of Health says many counties have already supplied vaccines to adult family homes. And for those still behind the trend, the DOH says they'll have their first doses by February 22nd.